What if I told you Kenyan hospitals are charging you for drugs they never gave you? This is Kenya News Update today. Coming up, you'll discover a massive healthcare fraud scheme and how the government is fighting back with a secret police unit. Meet a typical Kenyan patient. Let's call her Mama SHA. She goes to her local clinic for malaria treatment. The drugs should be free. She gets a bill. She pays, but here's the twist. The drugs were never dispensed. The clinic pocketed the cash and still billed the government. And this isn't a one-off. It's a system-wide scam. The Social Health Authority, the SHA, just dropped a bombshell warning. They've noticed alarmingly low drug dispensing rates in some facilities. That means patients are being billed for medicines that never leave the pharmacy shelf. In a statement on Tuesday, January 20, the SHA said it will not pay for such claims. They will deduct the drug component from payments where they catch this fraudulent billing. All primary health care services and medicines are fully covered by the authority. Patients must not be charged a single shilling. But here's what nobody's talking about: the scale. How many facilities? How much money stolen? The SHA isn't saying, but the warning is clear. We're watching. And then something shocking happened. Just 2 days before this warning, Health Cabinet Secretary Aden Duale made a chilling announcement. He revealed a plan to set up a specialized anti-fraud police unit. This isn't just about paperwork. This is a crackdown. Speaking on Sunday, January 18, CS Duale said this unit will deal specifically with fraud under the SHA. But wait, there's more. The unit has a second, even more aggressive target: quack doctors and unlicensed health facilities. Duale's words were a direct threat. If you are a quack doctor or healthcare practitioner who is not licensed and has not gone to school, I am telling them they better look for another place where they can do quack business. In the healthcare system, it is not going to work. We will crack the whip. This is a seismic shift. For years, quacks have operated in the shadows. Now they're in the crosshairs of a dedicated police force. And here's the part that will blow your mind. The ministry isn't stopping there. They're introducing a new regulatory framework called the scope of practice. This will require medics to treat patients only within the specific areas they studied in school. A dentist can't do heart surgery. A clinical officer can't perform neurosurgery. This move aims to lock down professional boundaries and protect patients from dangerous, overreaching practitioners. So what does this mean for you? The implications are huge. On one hand, this is a massive win for patient rights and safety. The government is finally taking fraud and quackery seriously with concrete action. Your shilling is protected. Your health is protected. But on the other hand, some will ask, is this creating a police state in our hospitals? Will this new unit be used to intimidate legitimate health workers? And will the scope of practice rules create bottlenecks, making it harder to get care in remote areas? The tension is clear. Some say this is a necessary purge to save lives and billions of shillings. Others fear overreach and bureaucracy. But one question remains unanswered. If the SHA is catching this fraud now, how long has it been going on, and how much has already been stolen from taxpayers? Do you think a specialized police unit is the right way to clean up Kenya's health sector, or is it a step too far? Drop your take in the comments. Subscribe to Kenya News Update today for more breaking news that hits your wallet and your health.